and
the number of people that they have die waiting for surgeries is off the charts.
Right.
That's a fact. That doesn't happen in America. People dying waiting for surgery. It doesn't happen.
Yeah, but conversely, again, you could say
medical bankruptcies. Like, there's a lot of more. I would say worse problems here.
That's 5 people that are sitting there moving paperwork, sending stuff in, resubmitting, all for the purpose of 2 clinicians actually seeing patients.
Right. So if that's your problem, kicking poor people off Medicaid is not going to fix that problem. You know, you say like the reason all these pharmaceutical companies are going after the big diseases is because that's where all the big profits are. I would hope you would, so Trump just announced his plan to attempt to negotiate down drug prices and cap them at the most favored nation price if they refuse. And if we're not subsidizing R&D on the back end, well, I think a lot of these pharmaceutical companies are just not going to invest in research and development. They're not going to invent new drugs, and that's a bad thing. If you want to help me continue to produce content, liking and subscribing is greatly appreciated. Also, make sure to check out my Discord server, linked down below, where you can also find my Twitch, my Kick, and my Twitter.
I want to ask a question. So, did we actually cut the medical,
Oh, this hasn't happened yet. This is for the proposed Republican spending bill. They're going to
really pass it.
So they're going to pass it through the House, or they're going to.
It hasn't happened yet
this week. And the reason I'm calling it out is because we know what the effects of this are going to be. I'm actually trying to advocate for people, anyone in the audience, for Sarah and my audience. Hey, like, if you live in any of these states, or if you don't, hey, like, go to the Democratic website or 5calls.org, call your senator, say, hey, I don't think you should cut this Medicaid. But this has not happened yet. This is
one of us.
So remember, obviously it has to pass the Congress. So there's a lot of process through that. Mm-hmm. You're talking as if it's happened. Or
why doesn't Trump just declare an emergency? Just like
they have a House and a Senate majority. If the Republicans want this bill passed, it will pass.
It's like you're allowed to advocate for and against the bill as it's being created.
Just in case anyone forgot, Medicaid is for adults with low incomes. And so, I think most people already know that, but one of the things that Democrats and actually most Republicans had worked really hard for is that you don't have to crawl on the ground, to take your kid to get, vaccinated, to get, if they have a temperature, you can take them to get the correct care. Something the United States typically has done well, right? So there's a reason to fight for something like this.
I'm gonna step away for just a quick moment, gentlemen. I'm gonna leave Flow State in charge.
You're gonna be mean to me.
He's not even here.
Well, they already know what I'll do if they are. They just got a nice brief example of it.
On you.
I'll just be 2 minutes. I'll be right back.
All right.
He's literally not even on.
I know, that makes it perfect.
What happens when the inmates from the asylum?
I just wanted to add that still you're going to be taken care of, especially in New York City. They will not deny you, and then obviously, yes, you might have a bill or not, and then maybe they'll pay a portion of it. But the
you're not turned away anywhere. All due respect, you're just I see them. These people are not. They're not turned away. So
but the 2 issues is one, people don't seek preventative care.
They aren't. Hey, listen, 17 years in hospital systems. I know how they
work. I was one of those people. I broke my back, burned my hands, and had a massive amount of needed medical care. I was broke, penniless. I lost my job because of this stuff that had happened. Suddenly I couldn't work, and they replaced the skin on my hands. I didn't get any surgeries on my back.
Die, right? But my point to that is, one, it does create a chilling effect where people are not going to the regular checkups. They don't know to what degree government will help them. Well, hold on, and let me say that
also, you're in charge.
If this, let's assume that everyone was just going anyway, and everyone who couldn't afford it was still being taken care of. To that, I would say, well, then it sounds like we should then do the most efficient thing and pay for the programs that actually make this cheaper, rather than have them pay full out-of-pocket medical, or we're paying the full out-of-pocket medical cost rather than the insurance costs, which would otherwise be cheaper if we put it into Medicaid.
The obvious issue with the healthcare industry is that we want to have fast wait times and high quality. And that's something that's very expensive, right? And that's our issue, is that we don't want to be the Canadian model where it takes forever, but it's good quality and it's cheap.
Not good quality. That's not correct. That's incorrect. That's factually
decent
incorrect.
Quality. We'll
it's
go
not.
with
It's
well,
just
you
self-relief.
All right. Sorry.
They're really good at that assisted suicide.
It's a bunch of
I'm correcting.
and
The number of people that they have die waiting for surgeries is off the charts.
Right.
That's a
what I'm
fact.
saying.
That doesn't happen in America.
Yes,
People
I
dying
understand
waiting for surgery. It doesn't happen.
Yeah, but conversely, again, you could say
medical bankruptcies. Like, there's a lot of more. I would say worse problems here.
That's very true.
What Pursuit is talking about is this like iron triangle, right,
Guys, I'm
of healthcare.
to be in charge here.
That is what I'm talking about. Correct.
Yeah. So like usually there's going to be a trade-off between cost, quality, and access, and they're in this triangle, and you can kind of. Right now, the U.S. is probably just leaning too much on having too high a cost, and Canada might be leaning too much and having too low a cost, but really poor quality or really poor access. But there's clearly something better.
Quality non-fund. I wouldn't even concede that there are degrees not as good, but to talk about the quality of healthcare in like Germany or Canada or any of these places where I'm very familiar with the people that use the system, this is not something that everyone's like, this is dog shit. We're sucking. We all wish we had the American system. They don't vote this out because it is. To a degree, a little slow, but it's good quality healthcare where people are mostly taken care of, at least to the degree that I want them to be. And it
does take forever, though. You have to be real. That is a real
issue. There are longer wait times, and I agree that can suck. I'd rather wait a little longer than not get the healthcare in and of itself.
Listen, that's a complete straw man, because here's the thing. You wouldn't want to wait longer if you got fucking cancer in your leg. You wouldn't want to wait longer.
Sure.
You wouldn't be okay with how long you wait.
Wait longer, like what their wait lists for, just like with organ transplants. Like sometimes this is just a zero-sum game of like, hey, we don't have enough fucking organs for you. But when
that's not an oranges to oranges comparison. There's a wait list for that.
You're talking about diagnostic. So can we isolate to like diagnostic care specialty? So lumberjack, your claim, like, because pretending I don't know that much about healthcare, but we're saying that referrals to specialists, we're talking about follow-up care, we're talking about the recursive development of a healthcare system to some extent. I'm supposed to trust some guy that probably quotes Breitbart, to learn about this stuff. That's what you're telling me. You're Breitbart? The only guy here that I think probably quotes Breitbart.
Duck, why don't your questions make
Ducky,
sense?
in case you weren't paying attention, 17 years in healthcare working in hospitals. 17
years.
17? Yeah, so I know more about healthcare in the U.S. than
Lumberjack, you don't have to defend yourself to a guy in a tank top and a duck tie.
He only plans for 24 hours.
That is absolutely right.
Well, can I bring a number into this real quick? Lumberjack. I want to give credence to Lumberjacks.
Presidents come here to the United States to get operated.
Yeah, we have better quality healthcare.
We have the best quality. No one
this
else
is the best country when so there's a reason.
Like what we're complaining about is about the fact that we cannot afford it. That's our issue.
Hey, listen,
and Lumberjack, to your credence, right? Like I think I just read this. Someone's mentioned this to me before. I think.
What about trans care? Like, isn't trans care untreated?
Please be quiet. Please be quiet. I'm sorry. It's just like I know what you're trying to do. 17,000 people a year, I think, died in this 5-year study in Canada for wait times, right? Like this is bad. This is not good. I don't think that the Canadian, it's the utopia. Some people are like, it's the utopia. Everything's perfect there. There are clearly problems with this. But if you look at like, all right, versus how many people a year like die from wait times in America, I would say probably less. I don't have that number off the top of my head. I know that about 50,000. Yeah, I know this is per capita, but like 50,000 people like die just because they don't have healthcare or don't have access to healthcare. I'd rather have a little dip in quality, but a guaranteed, like, hey, we're gonna like at least do this preventative care. We're at least gonna cover these costs, and I'm happy to pay this.
Have you considered an antidote that Lumberjack has ready? Go, Lumberjack, go ahead.
I've lived through it, and I can tell you that many people don't go to doctors because they just don't go. There's a massive part of the population that doesn't go to doctors. If I were Powder Dusty, he's so pretty, he never has to go to a doctor. He's just going to wait until his freaking leg.
And I never do.
I mean, that's a personal opinion.
Lumberjack, do you think if
that
we
is
just...
a personal opinion? That is not...
No, that's fact, Ducky. I worked in the...
No, it is not a fact.
It is fact.
Do you think that...
Excuse me. I'm going to play degenerate doggy porn if you don't stop it. Now stop it.
I did have a request for the firefighter again.
You said you wouldn't share a sex tape.
Tomato, fierce and red, juicy curves, this message is
Lumberjack, I don't have this data on hand, but I would hope that you would acknowledge that it's likely that in countries with lower healthcare costs, there's probably more preventative care going on. Would you think that's likely at least?
Have you ever seen a clinic open up in Canada?
That's a great answer to my question. Do you think it is likely that in countries with lower costs?
It absolutely answers your question because it's absolutely about access. They don't have access because their doctors stay here because the system here is that much better. They don't go back to Nigeria. They don't go back to these other places. They stay here. Many of them stay here. And that's the issue.
So it's your position. Is your position, which again,
have you been up north? Have you been?
No. Hold on. Is your position, just to be clear, is your position that countries with lower healthcare costs don't have more preventative care? Is that your position?
I didn't hear what you said.
Sorry, is your position that countries that have lower healthcare costs don't have more preventative care? Is that your position?
No, that's completely oversimplifying it. 1,000% oversimplifying it.
Okay.
The issue to Lumberjack is like if you look at the satisfaction rates for healthcare, it's like you're the way you talk about Canada or any of these socialized medicine places is like there's just people dying and they all hate it and like
never said that.
Well, sure, but like the way you're implying it seems like maybe anecdotally like
I don't think you gave that implication.
When I'm actually
about people with wait times, but if you look at the satisfaction rates for these countries, they're phenomenally higher than the American system because we unfortunately just don't. We let a lot of people slip through the cracks. Sure. Okay.
Right?
I'm conceding. Maybe you didn't say that. I'm saying, look, the people in these countries like their healthcare way more than they like ours.
And that's fine. They can keep perfect. They can keep it. I don't want to die waiting. I'm good with that. They can keep it. I don't want to die waiting.
Yeah,
we actually.
You're a millionaire.
You work until September. Yeah, I absolutely am. And I did it from being a ninth grade dropout. But I can tell you that no Canadian citizen, and maybe your feed on Instagram is just too doxed. But the fact of the matter, hold on, let me finish. Fact of the matter is that there are tons of people there that don't like their healthcare, don't like how their government's running.
Yeah, it's about 26%.
I promise you, it's higher.
Why? Based on what?
Based on actually talking to people there.
Come on.
I've analyzed people's satisfaction off your 17 years of talking to people. Like, I'm sorry, this is where I got to be like, sorry, dude, that's just stupid.
No, that's fine.
That's kind of like sounds almost like just pearly things. Well, I talked to 1,000 women, and so therefore that's the.
No, I worked in healthcare.
All I'm saying is,
you don't know how long I've worked in healthcare.
I will add in, gentlemen, that in that additive, we had a debate, forever ago, and it was about the line for unaliving yourself, what's the word, euthanasia, and we were discussing in Canada particularly because the video clip we pulled was people who couldn't get good health care that they were so poor that they'd actually would prefer to be relieved of all of those, pains. And it was actually really sad to watch and talk about it, but that's a thing up there that they actually have a line to unalive themselves because they can't handle all the medical bill, or not medical bills, but the line for the medical care, and they're so poor and there's like social structure or welfare or whatever just wasn't enough for them to survive reasonably.
Yep.
Yeah, I mean,
losers.
I don't think that should happen. That is maybe inflating the statistic that I brought up. Maybe it should be higher than 26% dissatisfaction. They all just died, but I don't think that many.
I mean, I just want to say it might be like a non-problem, but also so Lumberjack, who knows? Maybe you're right. Maybe there's nothing political or social about healthcare in the United States. But it's also like turning the knife when we have obvious statistics in mental health, and it's probably easy to extrapolate that in certain geographies, maybe certain smaller populations, like if as well as talking about when there are social or like critical issues in healthcare, wherever that comes in, like it's like turning the knife to say, well, it's just nothing, right? Like what does that actually mean to say that this problem is possibly something, but then it's nothing? I don't understand what world this is.
I don't understand what your question is.
Nobody ever does. Nobody ever does.
Do you have a response?
I will say,
conversation.
Doc did this last night with Rob Noor on Grid's channel, and we all were just like, what?
And Doug, I think you're awesome. funny. I like you, but I think again, from a healthcare perspective,
You don't have to tell me I'm a Jack. I don't know you.
I'm not saying we're going to hang out.
That came through loud and clear.
I watched you in the stream that you were on with Millennial Mike. I genuinely liked you. I thought your questions were funny. I think that one of the challenges, 17 career years in healthcare, watching all the things and seeing all the things that I've seen. There are a lot of things that people just don't know about. Like hospitals. Does anyone know what a typical U.S. hospital makes in margin? Just guess.
No, not a lot. I think there's regulations.
Google this.
Does
it matter?
No, it's not.
Can I ask you? Let me put this in the room. Let me ask you.
That's my guess.
You shut up.
No, let me ask you. So is it a regional healthcare, a small healthcare, nonprofit?
Shut the fuck up.
Okay, I will.
Bitch.
Thank you.
He did ask everyone, to be fair, Sarah.
He did.
We all
He wasn't giving an answer.
No, then you shut your mouth and allow somebody who does know to give the actual answer. Just common sense. Lumberjack, could you provide the answer, please, of the margin?
It's 1%, 2%, and 3% is what a lot of these places make. I mean, that should they're in business and they're making 2 or 3%.
Like Salesforce.
That's not really, no. But this is what's supposed to keep us alive. So I think that the healthcare system largely is broken. I think it definitely, absolutely, 1000% needs to be fixed.
So the idea to you is that we should be charging patients more because their lives are worth so much that they should be paying a higher premium, right?
Yeah, you're not going to get me there. I pay $3,300 a month because my daughter had cancer. So you're not going to get me there.
All right. So we should just do the same thing. That should be more, right? Because that's cancer. So if we're talking about a broken leg, we should be charging it $50,000 or something.
Yeah, I mean, clearly you don't understand how insurance
what's the
works.
margin? What's the margin that it should be at then?
Well, no, the organizations, listen, how many employees do these places employ? They employ lots of employees, and we still want innovation. We still want all of these things to come. I think that the system, largely speaking, is broken because of the amount of red tape that it takes to get anything done. Walk into any doctor's office. Hold on, Pursuit of Knowledge. I'm going to give you some. Walk into any doctor's office, and you're going to find you've got 5 people sitting behind desks and computers, and you have 2 clinicians. That's wrong. That's not the right way to do it. You have 5 people that are sitting there moving paperwork, sending stuff in, resubmitting, all for the purpose of 2 clinicians actually seeing patients.
I actually hold on. I agree with you. Administrative costs in the U.S. are too high, and a lot of that is actually because we have so many different insurers under so many different programs. I think some type of single payer or more managed competition model would actually reduce administrative costs a lot. But if that's your problem, kicking poor people,
right? These libertarians only believe in private industry,
right? So if that's your problem, kicking poor people off Medicaid is not going to fix that problem.
It's hilarious because it's so funny because hearing TheSoyPill talk earlier about how efficient it needs to be, we need to cut waste of spending, right? Because we shouldn't be spending $1 more more because we just live efficiently. You sound the exact same way, Lumberjack, with your libertarian ideas, that you need to have the most efficient way of living, that business needs to be efficient, that government needs to be efficient. The problem is both of those ideas are just wrong because it's a sliding scale.
Wait, what did I say about
should I get a game of any of my 2?
Oh, absolutely.
It's wrong.
Clearly you figured it out.
The problem is that your personal antidotes of living and working for a Canadian
experience. That's what we call that. Experience
for 17 years.
That's another word for
personal one. It's not enough to diagnose the overall systematic issue that is the healthcare industry in the United States. I'm sorry. You have some knowledge of that, and that's fine. But at the same time, just because you saw a couple people not working efficiently doesn't mean bullshit, bro. I'm sorry. It doesn't mean anything.
No. Look, can you just engage with my 2 points? Can you just engage?
Excuse me.
Dude,
are we all agreeable to some degree that there is still a lot of waste in the healthcare system? Things that we're being charged for, or
Okay. Yeah.
I mean, have a baby, and when you get that itemized invoice, you see the shit that you're being charged for, and you're like, "What?"
But that's because of private industries.
It didn't make
private insurance companies.
No, it's not.
No. Look, Lumber, this is why I wanted you to engage with the 2 points that I brought up earlier before we got derailed again, which is 1, administrative cost. All these administrative inefficiencies would be lower if there were less insurers, if more people were on like a single government program or whatever. Providers were only able to charge one price to all insurers. And Number two, if this is your issue of healthcare, cutting Medicaid doesn't really fix anything. It just means there's more uninsured people.
More uninsured people that are still going to the doctors.
I mean, yeah, but number one, they would probably seek less preventative care. I would hope you agree with that. And two, if they're going to hospitals uninsured, that means usually when you go to a hospital or whatever, that you have to pay a fuck ton of money. They can't pay that money, so usually the government has to subsidize that on the back end, and where we end up paying the money anyway.
It's actually
what do you mean? No,
that's not how it's actually done.
That's not how it's done.
But I can tell you that one of my tenants is actually an all cash provider. She's a nurse practitioner. She's an all cash provider. She's able to run her entire business with basically just one person at the front desk and two people that are able to see patients. And, her fee for getting an appointment is $90.
Wait, Lumberjack, can I ask? Because maybe I'm just completely uninformed. Let's say an uninsured person, Mike, please. Mike, please. If you're going to the hospital and you're uninsured and you can't afford it, who's paying for it then?
It's called indigent care. Is what it's called.
Okay, who pays for it? That's all I'm asking. I'm not trying to gotcha. I genuinely, I'm asking you to tell me.
Yeah, so literally what's said, you don't have any insurance? Okay, please still take a seat.
Then they see you, and they still see you, but then who?
And then you get a bill when you leave,
and then
you'll get bills in the mail, right. And then your option is at that point. Do you want me to answer? So you get bills in the mail, and then at that point you can contact the hospital and you can say, I don't have insurance. Mm-hmm. I don't have any money.
Okay.
I need to. I don't want to file financial bankruptcy. Right. And so, is there some sort of a payment plan that we can work out where I can make payments to you?
Right, but if they don't do that, then what?
I haven't ever seen that. I haven't ever seen that happen.
Well, okay. sometimes
this is why we can't rely on your anecdotes every time.
Do you want to know how it actually works?
Go into medical bankruptcy, and then who's paying?
Do you want to know how it works?
How payment plans work?
It's a three-step. You asked. I thought
no,
you wanted to know.
Well, first of all, I asked who's paying for it, and your answer was, "Hey, you could do a payment plan." No, I'm asking you if they don't pay for it, who pays for it?
So the hospital has something called write-offs. That's why they have it 3%.
What are the actual bank accounts? Yeah, what are the actual bank accounts, Lumberjack?
What they actually do is if I say I can't pay for it, and they go, okay. We'd like to work some sort of a payment plan out with you. And you say, I can afford $20 a week or something like that. And they say, okay, here's what we're going to do. We need you to fill out basically a personal financial statement. They fill out a personal financial statement that goes into the hospital. Hospital says, I'm sorry, but Soy, you've got a lot of gay porn subscriptions that you're watching. And it's to the tune of
I would never pay for gay porn.
And see, that's the thing is like you're so handsome you can get it for free.
Exactly. I have it in my DMs.
You're welcome for the setup. See what a team player I am. And so the issue is that then they have the option where they look at your finances to see if it's something that you can then afford, and then
or they can garnish your wages, right?
Right. No. That's far down the line. Let's not act like
sure.
You're getting your wages garnished. That's not how it works.
My point is when you talk about the write-offs, it seems like this is a long-winded way of saying
the government doesn't pay the write-off.
Who pays the write-off then?
They do.
That's what I'm saying. The government doesn't pay the write-off.
What's happening? Oh, hey.
Look at that.
Here.
I love it.
Speaking of gay porn, two sweaty men going at it.
Hey, listen, there's no hugging that needs to apply. So here's what happens. So the hospital, two lovers too far away. So the hospital will say, okay, clearly you can't pay. Clearly you can. So they might say, clearly you can pay. Mm-hmm. And when they say, yeah, clearly when you can pay, then they start going after you. Like if you've got assets, if you've got houses, and if you've got, all of these other bank accounts and trader accounts and all this other stuff, they're like, fuck you. You could have paid, you could have had insurance, but you chose not to. So now we're coming after you and we want you to pay.
Okay.
But if you are truly indigent, then what they actually do is they will literally take the entire bill. They have money that they set aside from all of the other bills that get paid that then is used to take credit on those accounts. And what they're able to do is they're able to do a cost accounting measure to actually reduce it to zero based on funding that they have, but then also mark to market of cost.
Right. And so is this like a regulated, like you must have this much liquid, in the same way banks have to have a amount of liquidity for this?
It isn't.
Like they do this based on a business decision?
Well, exactly. That's exactly right. They do it based
I'm just curious about that. Well, okay. So to all of that, what I would say is, yeah, okay, sure. But this doesn't negate the fact that there's like 500,000 people every year are going into medical bankruptcy because they literally can't afford it. And it's like,
don't disagree.
Right, and so what my whole point of this is
bankruptcies though are choices. Like there are very many
essentially,
of them.
But I don't think all of them would be. And my question is, how does cutting Medicaid fix this? Because if you were to come to me and you're saying, look, Lumberjack, he's running for president, and he's going to say, look, I think this is a bloated, overblown, regulation, red tape, piece of bullshit system, and I want to fix this by doing XYZ. This is how we can make it cheaper. This is how we can get more people on it. Sure, I could hear you out there. What I'm saying, my argument is not against that. My argument is against, look, Trump's current idea is let's just cut Medicaid to pay for the tax cuts. And I think this is going to hurt America because it's going to shut down these hospitals. I don't know that all these people are going to necessarily get all the care they need. I'm sure a lot of them, like you said, will go to the hospital. They won't get turned away. Maybe they'll have payment plans. Maybe they will file for medical bankruptcy. But I think a lot of these people just aren't going to get the care they need. And there are studies that show that the amount of deaths that will result from this are in the tens, if not hundreds of thousands.
So I disagree with those factors because those guys are never right with their projections. They just aren't.
I can't contest if you could
show me any of these studies where you looked at it and go, see, they were totally fucking right. Like they just aren't. They're wrong. It's propaganda. It really is.
Okay. I mean,
so what I want to, but here's what I would tell.
Hold on. I just want to pause here. Sorry to interrupt, but it's like, look, if it is all lies, if all these studies are lies, then I can't engage on like a factual basis any further. Like this is all my ability to navigate the world is to rely on people who know more than me, and you know more than me about healthcare. Don't get me wrong. However, I do trust the experts and these projections to a degree. I'm sure if we had a very specific debate on this, I could find studies that show, like they showed that when they expand. Well, here's a study that I'm sure you could find if I Googled it right now. If you said, look how many more people have not died from medical bankruptcy after the Affordable Care Act expansion, the Medicaid expansion that allowed more people with less means testing and a greater range of people to go on this and get better healthcare. I think you can literally see how many fewer people went into medical bankruptcy and how many people got better care and did not die. I think there's literally, we can find these stats right now. If we want to go look these up, I would assume that the opposite would be true, which is if you kick more people off or if you close these hospitals, there's going to be people. Let's say it's like less than 1%. Maybe it's an incredibly small number, but you must see someone is dying, right? Someone is dying. Someone's going into medical bankruptcy, right?
Yep, sure. But that's the thing is though, is medical bankruptcy doesn't mean death. It doesn't even mean financial death.
No, of course not necessarily.
But so all I'm saying is that here's what I do know. I do know that Medicaid does not negotiate drugs. They get something, and the other issue too that they have is something called a DRG. Do you know what that is? The DRG.
Not off the top of my head.
Okay, so a DRG is basically a procedure where the government tells the hospital exactly what it's going to pay. And they say, we're only going to pay you $400 for this procedure.
Yeah.
The problem that we have is that procedure might cost the hospital $650 to deliver. Right.
This is, just to be clear, this is the diagnosis related group. That's the one you're talking about? Okay.
Mm-hmm. Yep.
If you have any acronyms and I don't know them, please explain them to me.
No, sure. Yeah. And so the funny thing is most of the full words, I don't know them. Healthcare is acronym hell. It's absolute acronym hell. Everything is,
Don't worry, I worked in aerospace. I know. It's
exactly. Yeah. So it's just a nightmare. It's like, it's all Fetzer valves these days. It's all ball bearings these days. But that's the biggest challenge is I don't know what the right fix is. I can tell you that there's big swaths of waste, fraud, and abuse that can be taken care of very quickly, which are simple things like the drug piece. With insurance, kill me.
Oh my God, kill me. Oh my God, kill me.
They're $350 a month. With no insurance, they're $19.
Oh my God.
With no insurance, they're 19. You're paying out of pocket, or the insurance
$350. I'm paying out $350 out of pocket.
Okay, yeah, that's bad. I'm sure there are ways of this is inefficient.
But I can't lie and say I don't have insurance because I do.
Sure. Well, here's my issue, though. I mean, Nonfon was kind enough to show this to me, but like $33 billion in public funds were used to pay for people who don't have health insurance in 2017. So this is a thing that happens to a significant degree, and I think you'd be
there are federal subsidies
this is not
for uncompensated
at least
care.
A little, if not a lot. When we pick off a lot of,
Yeah, it certainly is going to increase, but it's like any business. You look at any business when it's not affecting the health.
This is crazy. The fact that like this guy kept saying, "Oh, they put him on a payment plan." It's just like I just want to ask the whole thing.
I'm not saying what I'm saying is if you're still going to be at certain
uncompensated care, which there are.
The idea
Medicare pays out some uncompensated care, not all of it.
No
I'm sure,
one's
but
life
a
is
lot of
for
it.
sale.
Oh my God.
The idea is that right now $33 billion is coming from the government to take place in that and play their role and be a part. The idea is what's the more efficient way of doing that is really always the question.
Right. No, and this is why I said at the beginning, my contention is with the way that Trump is weakening the system. If you were on the stage and you were saying, this is a better system, I could say that's a fair argument. Maybe we can debate the merits of that. But that's not what he's doing. He's not saying, let's make this better. It's, hey, we need money for tax cuts. Fuck all these people on Medicaid. That's what I'm upset about specifically. And if you want to talk about how to fix healthcare, I think we could have a more interesting debate about that. But that's not my contention with the Trump admin right now.
Yeah, I mean, what I honestly believe is when this goes through, I honestly don't believe that we're going to be rolling grandma in the streets and putting her in a bag and throwing her back of the truck. And
I hope you're right.
I'd be willing to bet that I am. Yeah, I'd be willing to bet that I am.
That's not happening.
I won't, because you can bet infinitely more than I can. So.
That is not happening.
I agree, Mike. Mike, I agree. I mean, I think, again, just, watching how they handle indigent care, watching how they do debt forgiveness, watching how there's 7 different levers and knobs that any hospital can pull. Certainly there's tons of people, and usually the people that end up going medically bankrupt are the ones that had money and assets in other things and chose not to have insurance. And then they were like, well, hey, you were trying to fuck us. And so now you gambled and you lost. And so now we're coming after your house. We're going to garnish your wages because you could have had it and you didn't. And you decided not to get it and put the burden on everybody else.
I've seen this Mexican dude. So I just want to say something.
Thanks, Powder.
I promise, guys, be quick. So I've seen this Mexican dude, don't even know how to speak English. He just had a liver transplant, no medical, no insurance. And I'm talking about this shit is like 50 to 70 grand, and he had it here in New York City.
What did he have?
A liver transplant.
What does this have to do with patient outcome? Does this have anything to do about people that need healthcare getting healthcare?
How do you not understand what he's saying?
It's a Mexican guy with a hospital gown on and just made up a story.
We're talking about the fact that you're talking about cutting costs in medical, but yet these people are getting help, and yet he had help. He had no insurance. Doesn't even speak English.
Well, so
how do you know this?
No. I mean, like we said, if you go to an emergency room and you don't have insurance or anything, they're not going to say no. We're just going to let you die or whatever. But our point was, one, people probably
you can do without.
Yeah, sure. People, okay, whatever. People probably seek less preventative care. People probably seek less preventative care when their healthcare costs are high. They don't want to go to the doctor to fix whatever issue they have until it's an actual emergency, and that ends up increasing costs on the taxpayers' end. And also, people without insurance, that's uncompensated care, and Medicare does have a program, or Medicaid, has a program that does pay out uncompensated care. I'm sure it's not all of it, but a lot of uncompensated care is on the taxpayer's bill at the end of the day.
You're talking about like a service, like a clinical value chain or something. I don't know what the right word is. And so, wouldn't there logically be a lot of compounding factors, in that case?
I just want to clarify something. It's not like he just went to the emergency room. They're like, oh my God, you need a liver transplant. Okay, here, sir. It was not like that. The guy.
I'm being hyperbolic with my example, but no, I understand.
Wait, Nonfon, I got to concede to Mike. After hearing this story, I think we should privatize all healthcare. We can move on.
And Uncle Fatty to come in just to say, "Thou shalt not interrupt the Queen Tomato." Duh. And Chuck in Tennessee says, "Song.
You are my sunshine, my only sunshine. You keep me something. Cass, tell me what the rest of the lyrics.
Never know, dear, how much I love you.
Flo, you have a lot of members.
Take my sunshine away." And Mike 23 with the 20 Powder Dusty gifted membership. Congratulations to all of you lucky lottery winners. Yeah. Mike, you're cheating on me, and I don't like it.
Thank you, Mike.
This is why.
I will also add after the
suck my dick.
I will also add, after the Inflation Reduction Act was passed, Medicare actually can negotiate down the price of 10 drugs a year or something.
Yeah, that's
dude,
what I thought,
10 drugs out of 90,000. Come on,
so it increases. Yeah, I understand, but 10 at a time, 10 per year, and I think the amount increases over time. But
guys, that's a fart. What you
really?
Right.
I wish we could negotiate more.
I totally agree, but I think there has to be that line because we have more innovation for drugs and clinicals and all the things that we have here in our country than there is anywhere else in the world combined.
I don't actually disagree with you there, but
it's facts
because we don't negotiate drug prices down. That's the reason we have more innovation, because these pharmaceutical companies have higher expected profits, so they invest more.
It is, but there's there can be kind of a fine line, which is that's why most of these that's why the government had said to them, hey, listen, we also want to make sure, and they have these goodwill programs. I was telling Soy, I was like, I pay $335 or $350 a month out of pocket for my meds, and it would cost me $19 if I didn't have insurance. But I can't lie and say I don't have insurance.
Why don't you just get rid of your insurance then?
Well, because my daughter needs it because of her cancer, and we're on a family plan.
I thought you said she got better.
That's not how cancer works, bro.
Yeah,
not really how it works. And trust me on this: when you have cancer, you're not going to
try this. Have you tried this? This is the Trump method. You go, cancer, you stop it right now, cancer. We're done with you, okay?
Yeah.
All right, you're not having any more of this. You go out of the body, okay?
That was really good.
How's your daughter?
I'm sorry.
How's your daughter doing?
Oh, she's doing amazing. Thanks for asking. Yeah, we got our absolute miracle. She was diagnosed with a cancer that had a 94% death rate within 4 months, and so we were very blessed to be in the right area of the world, in America, where they only have 3 of these proton machines, and so she did 10 rounds of chemo. You bitches. And she did
0 chemo. He's right to call me a bitch.
Dude, she's more of a man than I am.
She's more of a man than I am, and I gave birth, and I'm the one who made her. I was like, I made you, and I'm proud of that. Like, look at what I did.
God bless you.
But yeah, it was absolutely a miracle. But the cool thing about it is that instantly, with it being such a rare cancer, we were able to get doctors from all around the world to participate because it's so rare. But thankfully, we were very blessed to be in New Hampshire because there's only 3 machines in the country they can give for the type of proton therapy that she needed. And one of them is in Boston. So we were very blessed from that perspective. And so for me, I'm all about innovation, but I'd like to see on the areas that, on some of the drugs, on some of that side, the reason that they're constantly going after the big the big diseases is because that gives them the biggest return. And so what she was given for a cocktail for her chemo, they obviously didn't make anything for her disease. So it was very much relying on doctors, relying on team of people all around the world to say,
that called personalized? Is that called personalized or?
So it's different, Ducky, and the reason that it's different is because that is something. Was Ducky that asked that question? Sorry.
Yeah.
Yes.
Okay. So there's 2 different.
You're right. You're right.
There's one that's based on. So there's one where they can actually derive things via DNA, but that's not even a factor once you have the cancer. It's much more what type of cancer is it? Is it soft tissue? Is it hard tissue? She had stage at 5 months old. She had stage 4. She had lung, liver, kidney, and bone.
I was curious because I almost sent a startup through Founder Fuel in Montreal, which does a ton of AI research. Mm-hmm. They fund a lot of AI research. So I was working with a genomic researcher from North Carolina. So we talked a bunch about I forgot what that this is probably why I didn't get funded, but we talked a bunch about how personal healthcare and these technologies just become instantly more available and stuff.
Okay, I do want to ask Lumberjack, because it's going to be funny if I end up being more libertarian than you here.
Go ahead, Nonfon.
You say the reason all these pharmaceutical companies are going after the big diseases is because that's where all the big profits are. I would hope you would, Trump just announced his plan to attempt to negotiate down drug prices and cap them at the most favored nation price if they refuse. Now, I might be in favor of it if we were subsidizing R&D of drugs on the back end, because I've seen evidence that suggests that government spending on R&D, especially medicine, is not actually particularly inefficient. Now, Trump doesn't seem to be doing that, though. He's just cutting the expected profits of pharmaceutical companies, and if we're not subsidizing R&D on the back end, well, I think a lot of these pharmaceutical companies are just not going to invest in research and development. They're not going to invent new drugs, and that's a bad thing.
Can I say something, Lumberjack, with all due respect? I'm sorry, my good man. So did you hear that his daughter had cancer? Here you are talking about, no disrespect to you. You listen, I'm not trying to disrespect anyone. Forgive me. But do you understand? Like this guy's daughter had cancer and
really,
and we can talk about it. Yes, and
is that true?
And then
Wait, Lumberjack, can you confirm that your daughter had cancer? Can you tell us that?
Am I stupid? Okay, call me retarded. I'm sorry.
You are, bro.
You're retarded.
Then I'm retarded.
I've been holding it back. I've been being nice all night, but Mike, you're kind of derailing. Nonfon had a great question.
Yeah, I was just trying to bring it back to the topic about Trump, and
yeah,
that's
go
why.
ahead, Nonfon.
So the way that I view the negotiation of the drugs is it should absolutely be based on. So I want free market. So in that free market, it is having a conversation with them, saying, "Hey, listen, like I don't think we all want to start playing games with how long we allow that patent to stick around, eh? You know, maybe we don't let that patent stick for 7 years or 9 years. Maybe we just go 5 and go fuck yourselves." So that's where I think when it's you can't utilize all the things that the system gives you, and then when it comes for the payday, go fuck yourself. So that's where I believe that there is a happy medium. It can't be, hey, fuck you, you can't make any money. But it also can't be, hey, why is it that we pay more money than every other fucking place?
Well, hold on. You're a libertarian. You should know this. Price discrimination is efficient. Think about universities. Universities do a lot of price discrimination. You know, if you're relatively
universities
poor,
are toilets.
Well, yeah, but you can at least understand conceptually, like private universities do a a lot of price discrimination because it's profit maximizing, but it also increases social welfare. So if I can just finish the example real quick.
All of those universities.
Go ahead, Nonfon. Go ahead and finish it.
Just say universities have very high fixed costs, right? They have to build the building. They have to employ this professor. Essentially, you know, no matter how many students are coming in, or up to a certain margin of students, there's obviously a max capacity. But the marginal cost is very low, right? If they have the desk, they are paying the professor anyway. Well, any student, even if the student can only afford to pay, 50% of the cost that the rest of the students pay, they're still going to add on the margin a lot more to profits than they are to cost. And this is an example where price discrimination, charging some people a lot more than others, not only increases the university's profits, but also increases social welfare because more people go to university. It's the same exact thing with drugs, just replace the university with pharmaceutical companies, some students with rich countries, and other students with poor countries.
Yeah, so I think the challenge that you have in that argument is that when you look at the government and FAFSA, which is one of the biggest punchlines I've ever seen, is that what the FAFSA allows for, it's basically government funding for students, and the challenge is that it fucks over the student. Because somebody goes and applies for FAFSA, and it's based on their parents' income and what their parents make and what their household net worth is essentially. Are all three different contributing factors. The challenge that you have is in year one you get that awesome loan, right? The problem is you get the hey man, you're a handsome man. We're gonna give you a lot of money and we're gonna give it to you at a really low rate. Congratulations on that. And then we go to the second piece, which is year number two. Year number two kind of sucks because it's a little bit more expensive. But then year number 3 happens and it's holy shit, what the fuck, 11.9% if I want to continue my degree. That largely comes from the government not having any checks and balances and just saying no matter what the degree is in, no matter what university it is, it doesn't matter what the number.
It has to be accredited. It has to be accredited.
Listen, but that's
and that actually restricts other tax.
That worked out really well for DeVry and all these other companies that were actually accredited and actually be complete and total jokes.
Hold on, just real quick. We may have
Nonfon asked this question.
The guy from DeVry who ended up starting a company. So, and we were at a company out of San Mateo, a tech startup at the time. So, what's the data say?
Well, look, my point was just that
he worked in healthcare for 17 years, Doug. So data doesn't matter.
My point. You asked, why do we pay so much more than other countries? I simply gave an example of universities where price discrimination not only increases that company's profits, but also increases social welfare, right? More people have drugs under price discrimination, and we have more research and development under price discrimination, and pharmaceutical companies invest more when they're able to price discriminate. That's a big reason why we pay more for drugs. Also, part of it is we get newer drugs, we get higher quality drugs, and Americans consume more drugs per capita compared to like any other country. So not all of it is even like this sort of like unjustified, like subsidizing the rest of the world. Some of it is just that we get cooler shit.
But sort of. But at the end of the day, if I'm the one that's actually going to write the check, then yeah, I bet your ass I'm going to fucking negotiate. And I want to negotiate something that's in the people's favor because that's who elected me and that's why I'm here. I want to get something in their favor. So I think that where the drug companies have to recognize is when you're working with a government that giveth, they can also taketh away. And so something simple like going from 7 down to 5 years, how many billions of dollars does that cost the drug company? So I think negotiating with the government, it's not like you're negotiating with, the lumberjack landlord who cares about his family. You're negotiating with the family of the US and the guys who make the rules and can take that away.
Lumberjack, so I have to interrupt you. I'm really frustrated with this because you have been very self-assured in a lot of these things, and I just googled the FAFSA thing, and it's a fixed interest rate loan. It doesn't go up to 11%. Like you talk very assuredly.
No. You did. You weren't listening.
It's fixed interest rate for 3 years. Listening. It doesn't go up to 3. No, you said on year 3 it's it's 11% now, but that's not true.
Are you getting a FAFSA loan on your 3rd year of college?
I don't know. Are you?
Yeah, you're wrong. Exactly, you're not. So there you go.
That's
what you said it was. You said the FAFSA loan turns into that in the 3rd year, right? Is that not what you said? Or you said the FAFSA runs out.
Right. Correct.
Okay.
I think most and a lot of students also have like the actual mechanics. Like when you apply for a student loan, if I remember, you get a subsidized and an unsubsidized.
Right. Yes, there's subsidized and there's plus. But my point is, your argument is then that FAFSA is bad because it pulls the rug out from people and they don't realize their FAFSA ran out on 3rd.
No.
Like, what's your argument then? What's the 11% come from?
That argument is that we need more government intervention. I think I heard
the fact of the matter is that the government allows for universities to continue to increase their costs, not CPI adjusted, nothing. It's just whatever they raise it. And then
what does this have to do with FAFSA? I'm asking. What is FAFSA bad?
I can explain it to you again. Maybe you'll listen better this time.
Sure. Go ahead.
Okay. So here's exactly the difference. Okay. Usually the first couple of years, you're going to get a FAFSA loan.
Okay.
The problem is that year 3 and year 4, very often you aren't able to qualify for a FAFSA loan.
Okay.
So what ends up happening is you then have to go to the private market. When you then go to the private market for those loans, they are far more expensive than a FAFSA loan.
Right. So is your again, this is why, and you said no to this, but is your implication that FAFSA is bad because it runs out on the year 3 and year 3 they don't have a better option and that better option is worse because it's higher? Like, why is this an argument against FAFSA as a concept? Why not 3 years of FAFSA? Why not 4 years of FAFSA? Like, what is your point?
Yeah, because I think that the government is essentially allowing for these universities to charge what they charge because they're willing to pay whatever the bill is, no matter what. And the challenge is that at 18 years old, you're making the most difficult decision in your life of which school you're going to go to, what you're going to study.
Are you tired, Sarah?
And having to do all of that work. And the challenge that I think exists is that when you get to your junior year, you're kind of locked in. Like if you leave school, then
you dropped out in 9th grade. I'm sure you can drop out of college in 3rd year.
Yeah,
I have a college degree and I got loans and I have no clue what you're talking about.
We never know what you're talking about.
If I just look up the percentage of people who get private market loans, are you just going to be wrong again? I feel like I can just look that up right now.
Is it possible? Yeah, you can look it up. Hey, Nonfon, like you can look it up, but mine's based on experience and actually talking to the kids.
Okay, hold on. Are you telling me? Are you telling me if I to be clear,
please
I have
allow me a moment to reset the panel. I have the dono goals set. You guys have been knocking the dono goals out all night. Thank you much to you. But it is 1 a.m. for me, and I'm becoming a sleepy little tomato. So I have 2 options. We can keep going if you hit the dono goal, or I can go to bed and we shut down and everybody has dono goal. So Kissy Cat already coming in with the 5.
I know you have the funds.
Sarah, what do you think about some stickers and some membership donos? I think that would look great on Raging Tomato tonight. This has been a good talk.
Great. They have to hit the goal though. That as long as
I think if Nonfon's put his dress on, that would get the.
I'll tell you what, $100 buys it outright. Okay, it's set. But
that's pennies to you, Lumberjack. You're a millionaire. You can do it.
I can.
Millionaires are millionaires because they don't spend the money.
That's not true. That's not true. I know a lot of stupid fucking millionaires. I'll say that.
That's fair. But
tell you what, TheSoyPill, I'll buy you a new hat if you decide to wear it, because that one's despicable.
If you got a cooler hat, I'll wear it, buddy.
Kissy Cat in with the big 5 to say win chat. And yes, over here, nobody wins except for the chat. All of the panelists suck. They all go home total losers, and the chat walks away with their crown.
I'm gonna say wrong. I had a great time. So
Paige with a big 5. SoyPill's pickle plushies eyes haunt me in my sleep.
Oh yeah, we
need to see these eyes. Are they pickle plushy eyes?
That's Pickle Rick. That's obviously the best character from a very high IQ show, Rick and Morty, and he is wearing a Maha hat from RFK Jr.
I've got the same bit. I've got that same teddy bear as you, SoyPill, right? The Pickled Rick behind you. I've got that.
You've got that. That's awesome, dude. We should
guys,
we should touch them together.
That was a bit. That was a big thing.
Shut up, Ricky.
You just say gay. It's not a bad word.
Kissy Cat with the big 2 says L panel. Yes, this is true. But Nonfon has to pay for his own win around here. I love you, Nonfon. I've already told you I think you're going to go very, very, very far. And I can't wait for the algorithm to pick you up.
Sarah, nope. I got to contradict you. He, based on the numbers, is a less than mediocre.
Damn. Wait. She sends people with 1K subs to the top 1%.
That Nonfon gets picked up, because that's why I like the way I operate in the panels we've run, because it gives newer creators or people maybe who don't have the big audience a place where they can come out and share their ideas and be combative with people who do have the big numbers.
I just want to circle back on this, because Lumberjack, again, this is one of those, you seem to give a lot of ideas of how you think things should be going, and I don't even want to discuss the merits of this necessarily, because the reason this whole panel exists is we keep bringing up, hey, I think that this is a failure of the Trump administration, this is making it weak, and then your contention to that is not yes, it's more just hey, well, I think we should do it this way, and maybe that's an amazing way to do it, but do you not then have an issue, I guess, with what Nonfon brought up of these price negotiations? I'm up in the air on that, but you seem like you agree that this is a bad way to do it. Can we leave it there as insofar as talking about the Trump admin?
Well, no, I mean, I think that, that's a pretty broad stroke. Hey, you suck in this area, and so you suck altogether.
Well, I'm not saying that. I'm saying he's weakening that specifically. He's weakening us in that market. Just on that point, right? That's why I conceded at the beginning. I think he's making our military stronger. I wouldn't say that Trump is weakening every single thing. That's why I try to break it down into categories. Would you disagree with this specific policy?
So I haven't, in all honesty, I haven't read through everything that he's talked about on the Medicare side. But I can tell you that what I've experienced with the Medicare side has not been anybody getting turned away. And so I don't know if it's going to work or not. And I think that most people don't know if it's going to work or not. I think he's doing it because he believes it's going to work.
If I came and I told you I worked in the hospital and I'd met 100 people who got turned away, would you then say that it was bad?
Yeah, of course. I mean, we want people to be taken care of course. Yeah.
Okay.
I mean, that
happened. That's a real thing that I did. So I just want to let you
know. Would love to see it. You should probably do it.
I can't show you. I didn't have my camera at the time, but
how convenient. That's usually what happens.
Yeah. I just want to mention, by the way, to show how valuable this guy's experience is. I looked it up. The amount of college students that get private sector loans. In for-profit colleges, it's 9%. At non-profit colleges, it's 11%. At public four-year colleges, it's 6%. And at public two-year colleges, it's 2%. So none of them are above 11% of students getting a private sector loan. So I think this is a really overblown issue you have.
And I think you're wrong based on my experience.
I mean, the audience is just.
The only thing you've said all night. The only thing
you've
said all night is.
What is your experience? What do you bring to the table other than a bad
I'm a professional Wikipedia reader, and
to the table.
Oh shit!
Do you know what I bring to the table? So we got a double whammy of 2 hundos. One came in via Cash App from our lovely Kissy Cat because she couldn't spend any more money on YouTube, so she went the loophole route. Sends a big 100. She said an extension from Kissy Cat. She wants the panel to go on, as does the almighty. I swear these both literally hit the pin at the same time. It's beautiful.
How convenient for you, Sarah.
I know it works out so well.
Goal
hit. The goal is hit. So congratulations to you, panel. I'm going to go and pour myself another cup of coffee. In the meantime, I'm going to leave SoyPill in charge.
Me.
Definitely not you, Bricky. And Bricky, you better stay muted the whole time I'm gone because I know
I'll mute myself.
All
yes,
right.
mute yourself.
We can't understand.
This is my panel now. We're doing it the SoyPill way. Ladies, shirts off. Hair down. No, okay.
Whoa. And I'm gonna leave this one up here as a representative from Almighty Nate and Kissy Cat. On the way in, I want to see tomatoes in the chat from everyone, and shout out to Kissy Cat and Almighty Nate. You better all be saying thank you to both of them. Thank you so kindly. All right, back to you, Soy.
Cool. Yeah, I guess I'm gonna try to moderate this a little bit. I see we've got Mr. Green Screen down here with the MAGA visor. You haven't said anything. If you want to hop in, I also see your this guy Brick. Is that you dressed like the Green Goblin, trying to pretend that he's a grandma in Spider-Man 1? Yeah, if you want to talk. But yeah, what do you have to say, Mr.? I can't see your name, but Mr. Green Screen.
Mr. Bill, curious. Anybody who wants to answer it. Do you guys think that illegal immigrants should get Medicaid? Yes or no? Feel free to explain your answer if you want to.
No.
I think personally, and I'll defer to other people as well. I think that if you look at the costs of not giving them Medicaid, that does end up actually being more expensive. But I do think, and this is just for any service that illegal immigrants are going to use, we should find ways to either naturalize them, or if they're here and they're causing trouble, committing crimes, we should deport people that are here and causing crimes. So I think we should just find a way for them to be paying into these systems better than that they don't when they're illegal, so that if they do use Medicaid, they're actually paying for it and not freeloading. That's my opinion.
Yeah, just grant them work authorization so they pay into Medicaid. Like,
is getting rid of their Medicaid a good option or a bad option to help them self-deport?
Oh, getting rid of their Medicaid specifically? I think if you could show me that as soon as they're off Medicaid, this all of them just go back to the country, and this is a good way, an efficient way to do these mass deportations. Sure, I'm not saying all, but I'm saying if you could show this is a very good way of making people leave the country because they're like, oh, this isn't convenient to me. I was freeloading before. Sure, I don't think that's necessarily the case though, and I think if anything, it's just going to make they're not going to necessarily have the resources to leave, but they'll be there. Now they won't have Medicaid, and then any and all medical bills going forward will be funded publicly, which I don't like.
And Bill, I just want to bring up too that people sometimes bring up this issue of fraud in Medicaid, and it's really of course there is fraud because there's 350 million more than that now Americans, but that's I kind of get the the hairs raise on my neck a little bit. When I hear stuff like that.
How do we take someone serious?
Hear a question?
Or hat?
Was the question offensive to you?
Wait, can you say it one more time, buddy?
Was the question offensive?
No, Bill, not for Bill. This little Bane figurine guy just asked something. I couldn't hear him.
How do we take someone serious when they have a propeller on their hat? Your hands look softer than raging tomatoes.
My hands look what?
Soft.
I've actually got very bad workout calluses. I don't know if you can see these, but yeah. So, but your wife likes them soft, so that's why I keep the other one soft.
I'd still high five you, Soy.
Oh, thanks, buddy. Appreciate that.
That applies.
And the answer to your first question is you don't take me seriously. This is my defense. Whenever I say something stupid, I'm like, look, I'm just a dumb little guy, okay? All right? I'm just a stupid guy, okay?
That's true.
Yeah, I'm just a dumb idiot. So there you go.
If you had a though.
If I had a what?
If you had a real beard.
If I had a real beard, what? Then you'd take me more seriously despite my propeller hat? What do you mean?
Yeah, I actually would take you more seriously with the propeller hat. If you
you have a Bane Lego figurine profile picture. I'm not disparaging you for that, but it's just look who's talking, pot kettle sort of situation. All right, I guess. Am I supposed to take you seriously?
Sure. Here.
Okay.
And you have a shirt that says National Sarcastic Society.
Amish?
You have a shirt that my mom would have bought me when I was 12, so I don't know. I mean...
I don't
know what to say, buddy.
Okay.
Right. I do have this is what I kind of joined because the panel was discussing this when I first joined, and I want to answer from Lumberjack first. You said you're a libertarian, man. You gotta admit these tariffs are a mistake. You gotta admit that these are not optimal.
I mean, does anybody know? Like, show me.
Yes.
Well,
yes,
we've already had
it. He's been showing, bro.
Well, we've already had a GDP contraction.
The issue is that
the
Lumberjack doesn't know
on
anyone
bad legs,
who knows
dude.
about the tariffs.
Yeah.
So he doesn't know what we can determine.
Wait, from my experience, I tried to order a sex doll from China, and there's like 45% tariff on it. It was really.
Well, I mean, so that's probably a good thing. You know,
Nonfon, you should find whoever.
Wait, okay. So is your position? So why do you think that's a good
doll.
thing? Let's take the hypothetical sex doll. Why is it a good thing that I can't buy from China a sex doll?
It should be an American sex doll, clearly.
I mean, at the end of the, I don't care what kind of sex doll you buy. I mean, it's just sad you have to buy a sex doll. Like that's kind of the down.
Okay. Well, let's just focus.
Libertarian.
I prefer
actual
bullshit.
Libertarian against sex dolls? No,
Yeah.
no way.
I mean,
no, this is bullshit.
I said, yeah. So again, from my perspective, I think that most people don't understand all the moving parts that any economy has, and so
just read "I Am Pencil" then, Lumberjack. "I Am Pencil" covers exactly how
I'm
economy
good.
works.
I'm gonna read it.
Wait, you haven't read that in your Libertarian? Okay, right. Anyway.
What I want to say, yeah, I'm too busy making millions of dollars building
it's
businesses.
Like whatever. Okay.
Like seriously. Like here's the thing. Like this is the problem.
We don't care. You're trying to
excuse me. I care. As the moderator,
you're not
let me
hear
what Lumberjack is saying.
Yeah, shut your pie
This is
hole.
probably the wrong
What?
thing.
Wait, hold on, Soypill.
I'm sorry.
Just sit there, okay?
I'm in control.
Jesus.
Before you shut your pie hole, I'm telling you to shut your pie hole. Lumberjack, go ahead.
Yeah, so I think that one of the things that we find in business very often is that there are and clearly Nonfon, super smart guy, right? Guarantee really educated, like really, really, really off the charts smart, been to, I'm sure has at least 1 degree, if not probably 3.
Okay,
really
sharp. I gotta interrupt you now as the moderator. You have to give him real compliments now.
No, those are real. I think he actually
He's
has
19. I think you know that he doesn't have his degree yet. He's just a really smart kid, but you got to give him real compliments.
Okay, no, but I think
autism medication.
So I think he's a super sharp kid. The challenge is turning that into and monetizing that and finding how that actually helps society. We'll see where he ends up in 10 years or 15 years. So
True. Exclamation point TTS in the chat.
So
Can I have the Libertarian argument for why buying Chinese is bad now? I would really like the Libertarian argument against free trade.
Listen, I'm answering. If you don't like my answer, then I don't really give a fuck.
It's just a non-answer. That's the problem.
No,
no. It's not a real answer. That's the point.
Here's the point:
is the landlord, the idiot ass. The problem is you're not giving a real answer. Whenever you complain about Biden administration, guaranteed you're able to rattle off 5,000 or 6,000 fucking little facts. But now with Trump doing fucked up shit with the tariffs, I think we should wait 10 years to really see the economical impact. It's fucking retarded. That's our point.
Yeah, I get it. You're retarded. I understand. Thank you for coming clear. But I think
didn't work.
Wait, no, Lumberjack, I got to interject. You have to have a better comeback than no you. Go ahead.
Yeah, so I think the challenge is that in building companies and in building businesses, this is what I've done. And from my perspective, I voted for Trump. I believe that he's going to take us down the right path. It's going to repair the issues that we suffered from the last administration.
How the fuck is that ever possible?
Ducky, I am respecting Tomato's wishes. No interruption. Ducky, you've quacked your last quack. Don't make me boot you, all right? Let Lumberjack finish, then Nonfon can respond about the tariffs, all right?
Yeah, I get it. Yeah, I get it. So again, from my perspective, I don't focus a whole lot on federal government. I focus much more on local government because that's where I do all my work. So I care much more about what's happening on my job sites. I care what's happening to my tenants. I care what's actually, because in pursuit of knowledge,
why did you vote for a president? If you only care about that.
Pursuit.
Dude, how can I only care about that? Because I make a difference in people's lives every single day, giving them affordable housing. When you sit your dumb ass in that chair, only with opinions, doing
all
nothing.
night, you've only been talking about yourself and your own personal thing. Holy fucking shit!
Because that's the work, you dope. That's I don't understand what you don't understand. It's really simple.
It's not simple. The whole problem is that we've been talking about stats and statistics, and all night long you've been saying, "Well, in my personal experience, that every single thing you've said."
Dude, you can get as upset about it as you want. I base things.
I'm dancing to the banjo.
I base them on experience, and that's why I built many successful businesses. See, failed ambition.
Then why did you vote for a president when you only care about local politics? Go ahead.
Because I filled out the entire panel. Because I believe
you don't have to.
I know you don't have to, but I filled out the entire panel. The reason I filled out the entire panel is It will trickle down to the states. Absolutely, it does. I mean, do you believe that or not?
No, absolutely not. I'm not a Ronald Reagan trickle down economics.
Then don't.
Absolutely not. That's bullshit.
Yeah, then don't.
We know that's bullshit.
Dude, then go suck fucking Clinton's dick. It doesn't matter. Tomorrow, I will impact people by giving them housing that
and I'm impacting you directly right now. How about that?
Right. You're not impacting me at all. Dude, you're a fart. I won't even think about you again after this show. Okay. Like, you're a non-factor.
I don't care. That's fantastic.
Dude, I get it. You shouldn't care. You shouldn't care because what do you do tomorrow? What are you going to do tomorrow?
I do.
Yeah, you're going to go to work.
I'm a contractor.
That's right.
Hell yeah.
That's right. You're going to go to work. Yeah, you're gonna go to work. You're gonna go work for somebody else and be their bitch.
No, I'm in a small business. I'm a family-owned business.
Yep, and you're gonna.
Here's the thing. Exactly. Here's the difference between me and you. I don't talk all night about myself, and about because every single thing that I have to bring up is about a personal experience. Because excuse me, I have an anecdote where one person I know specifically did this,
Never said
and
that.
I'm an expertise because I've done XYZ.
Dude,
I could be talking about life, but it doesn't matter. What we're trying to talk about is that I know that's your personal experience that you are a bitch. And
no, you're a bitter bitch.
One, you can recognize things.
That's why you need to work for a family business because you can actually make it on your own.
What's hilarious to me is that
that's why you can work for a family business
because
you can actually do it on your own. You're like,
and the only thing you can do,
you know how to do this.
Only thing you can do
you'll blow it up.
is bring up your own personal experience.
Yeah, you'll blow it up.
You cannot live outside that world. But when we're talking about a
dude, you do nothing on the daily to make a difference in people's lives. It's noise. You're fucking noise.
It's only a 10-year system. We shouldn't really judge things yet. We don't know if it's going to happen. And then you vote for someone because, well, I just might as well fill out the ticket. I no fucking clue.
Yeah, Kamala was a great choice, dude.
Guess what? Tomorrow I'm going to do that.
Yeah, Kamala was an awesome choice. Good job. Yeah, that would have won.
She's a better choice than Trump.
Oh, yeah, sure. Yeah, she's awesome.
Right now?
Yeah. Oh, sure. Yeah. Oh, absolutely.
Yes.
Yeah.
Yes.
Yeah. Oh, definitely.
Absolutely.
Oh, yeah. Sure.
Are you okay?
Yeah. Oh, I'm totally fine, dude. You're gonna go to work tomorrow.
I don't think you are.
I hope you enjoy. I hope you enjoy being a non-factor day after day after
non-factor.
Day. Non-factor. Yeah. Non-factor.
Why do you think what you'd think as judgment is going to affect anyone else? Honestly. Do you think that has real impact on anybody else?
Do you?
Why even waste your time saying that? Seriously.
Why? Because I think you're so.
It's a waste
jaded.
of time. It's a waste of breath. I agree.
I think you're a waste of breath. I think you're a waste of time because I think that you're completely out of your depth and you have an opinion based on not actually experiencing anything.
No, all night you've been saying that you're an expertise in XYZ. You're not an expertise on these things. You're not. You only have personal antidote. You have nothing else.
Yeah. So where we come from in the real world, and you'll probably learn this when Daddy turns you over the reins to the business to you.
You don't even fucking know.
When Daddy turns over the reins to you and you try and actually figure it out, you're gonna blow up that business because you don't know shit.
Gentlemen, I just want to make a kind reminder that you are both grown-ass men.
Yes, absolutely.
Arguing about stupid shit. Lumberjack, I will kindly remind you that anecdotes never get anywhere in this space. We all run off of data. If you don't have the data to back it up, then nothing's going to happen. Pursuit, I think you're just angry that you're not in his position. That's all. You're just mad and shit happens. Outside of that, you're both little bitches. I love you all.
Sure.
Sarah, I'm mad the fact that he keeps bringing up antidote after antidote after
whatever.
Antidote.
Poor. Why don't you work for a living, loser?
Sarah, asked you muted. Now am I allowed to be let loose?
What? What are you letting loose?
Wait, don't let Bricky let it loose. Good evening. Y'all looking very sexy tonight.
And I did do that, right? So
I would really
attack these bitches.
Did you stay mute for me, Bricky, the whole time?
I did, yes, I did. Ask everyone.
I'm so proud of you, Bricky. Everyone, give Bricky a kind little round of applause.
I'm also very proud of Bricky.
Tomatoes in the chat for Bricky for shutting the fuck up like I told you. Anyways, I love you.
Can I make a request for a future 1v1 between Mr. Fawn and Mr. Lumberjack? I would love watching that. I would even watch it on my channel. And I would even, dare I say it, super chat your channel from my super chat money that I received to watch that. So.
You know what?
Not tonight because I'm tired and I know they won't both need time.
Oh, what, you're backing down? You're backing down?
I was gonna say if they've done so great, I would have just done it.
What's up?
Sure was something, wasn't it, buddy?
Yeah.
It sure was something.
Oh shit. Oh, I'm working. Okay. It was. I had fun though when I was allowed to.
Did you know that USAID is an NGO?
Dude, that was crazy. Dude, the USO is an NGO thing. And by the way, I still don't know if these people literally think China pays the tariffs, but that shit is.
I genuinely don't know that the prices are gonna go up. And like lumberjack, I honestly, I started off, I was like, okay, well, this guy definitely knows about housing at the very least. But then when he kept deferring, like when I would start complimenting, or not even complimenting him, like, let's assume you know more about this, and he'd be like, I do, and I'm like, okay, like I'm trying to give you this, and you're like snatching my charity away from my hands. And then when I finally say something, I'm like, well, what do you think about this very bad Trump policy? And his only defense is, look, buddy, I'm a millionaire and I work real hard, so I don't have time to look at all this stuff you're reading about, you unemployed fuck. And it's just
bro, and he worked in the healthcare industry for 17 years or what, like.
In all my years in healthcare, I never saw anyone do anything bad in the way you're describing. So I just don't think it's happening. And let me educate you on this. And I'm just like, fuck. Why did I bring a study? The study means nothing compared to your anecdotes. Like, I can't. Oh, it's so. At least Bad Gemini really ended it on a good note, man. What a guy, man.
Yo, Sarah, thanks for the raid. Hell yeah, brother. Let's get a twerk break for this one. Let's fucking go.
You should debate Lumberjack on a 1v1. I would watch that.
Yeah, I would love to. I think it'd be fun.
Get Sarah to sponsor it. You know what? If she says no, fuck it. I will host the Nonfon Lumberjack thing on the Soy Pill. This will be my first moderator, and no matter how biased I am to you, Nonfon, I will be a good moderator, and I will make sure everyone gets their speaking time. I think, what's his name? Pursuit of Knowledge, he's got good ideas, but he really needs to calm down and hyper-focus. Yeah. He keeps jumping all over the place, and he was derailing you, too. I was like, come on, buddy.
I know, yeah.
But,
yeah.
That was fun. I hope guys, I hope you liked that. I had a good time. That was, like I said, very short, 5.5 hours, a lot of time. Thank you again, S-Press, for the $100 donation. That was insane, dude. But guys, I'm gonna head off here. This is the end of this stream.
Thank you for the sub, John Hart. I appreciate it. Welcome.
Because I'm gonna be working on the video. But Nonfon, you're welcome to cash in on this.
Hell yeah.
Look, I can't invite you on the panel, but you should watch. I'm on the DNC panel next Tuesday. I will be there with Cory Booker, Rokana, and also all those small-time baby DNC influencers like Henry Sisson and Dean Withers. They're all so tiny and twinky. Nonfon is the only twink that we support because at least he knows what he's talking about and he's not smug about it, all right?
When
he is smug about it, he deserves it, okay? So, guys, if you liked this, I hope you did because I had fun. I'm going to raid into Nonfon and show him some love and ones, all right, guys? And I'm going to have a go sleepy time, a little soy rest, if you will, in my little gay little hat, all right? So thank you so much. Taekwondo in the deep state and have fun in Nonfon stream, guys.
And send Nonfon your money, red heart emoji, tomato emoji, red heart emoji, tomato emoji.
Thank you, Sarah, for the $20. Hell yeah, sub. Yeah, thanks everyone for subbing. I do have notifications set up to tell me when people sub, but on YouTube they are pretty delayed. But if you're lucky, I'll thank you for subbing. If you want to chat with me live, sub here or go to Nonfon420 on Twitch or Kick via the links below. Once again, please like and sub to help with the algorithm, and consider sending a donation through YouTube Super Thanks to directly support me, and I'll make sure to reply to any question you ask. See you guys next time.